Are you unknowingly sabotaging your own team success by overlooking these particular leadership practices? In this episode, we'll discuss how self-reflection, team optimization, and accountability can be the powerhouse behind creating a team that will help you to turn your venture into the leading powerhouse of your industry. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. You probably have heard of this. Your title makes you a manager. Your people make you a leader. This principle is not just a catchphrase. It's the cornerstone of effective leadership in this fast-paced environment we're in today. We've seen firsthand how fostering trust within a team can make or break your healthcare startup's success. Now, today we wanted to discuss the 4 major pillars on how you can advance within your team to be able to have a powerhouse driver for the big goal that you can truly create positivity in the healthcare space. Now, our first one is the mirror principle. Self-reflection in leadership. As healthcare leaders and innovators, you constantly are facing challenges in this dynamic industry because even though the way that we practice medicine perhaps stay the same, however, innovation, tools, diagnostic, the way that we perform procedures, diagnosis, and engaging with patients all have been modifying for the better. That might be a question for another episode of how well are we able to do that. Nevertheless, you have to consider that the biggest obstacle in your team's success might be staring right back at you. Something hard to chew on. Self-reflection is a critical risk management strategy often overlooked in our industry. Well, you need to ask yourself, are you truly embodying leadership qualities necessary for your team to succeed? Because even you don't think people are watching you, they truly are. How are you setting the best example? Even you don't think people are watching you, they are. In any situation, whether you are anxious, despite of how well you're trying to push that down, the way you communicate with your team will be observed. And that anxiousness, stress can be propagated to them as well. And therefore, when you are able to be in a better place, then your confidence, your patience can also be able to exemplify it on others. So consider the case of David Daly, the foremost CEO of Athena Health. When faced with declining market share, a significant risk of any healthcare tech companies, Daly didn't point fingers. Instead, he initiated a company-wide introspection, starting with his own leadership style. This bold move in healthcare communication led to culture shift that revitalized the company, resulting in a 17% revenue growth within a year. As a leader in healthcare innovation, you must be willing to critically examine your own performance before evaluating your teams. This involves being open to feedback, acknowledging your own role in both the success and failure. And if you truly learned through every experience, then you will never actually fail down anything because you're constantly learning and you are truly growing from within and from the bigger scope of your entire company. And definitely continuously working on your leadership skills. Now, we know there are hundreds of videos, books, podcasts on leadership, but it's not really about being obsessed on learning, but what are the specific things that you can truly adapt that makes sense for you and your environment, your team that truly can push things forward. Remember, in the healthcare industry where lives are on stake, there are ideas that become multi-million success versus a potential life-saving solution that never made it to the market. You have to be in the driver's seat to be able to have set questions and reflections to make sure that there are no room for ego. We're simply here to discover and grow together. And it's not also about learning so much, feeling like everything become so chaotic that you burn out. Your ability to self-reflect and adapt is crucial for effective risk mitigation and long-term success. So takeaway from this section is effective leadership starts with self-awareness and willingness to improve. Are you open to feedback from your team? When was the last time you actually had a sit down to get everybody else's reflection, impression, perception of how they are doing themselves, how they perceive you as a supporter, and how they are able to support you as a whole? Remember, if you cannot handle criticism, it will be really tough for you to truly lead in this market space of ever changing and ever evolving. So for you to be able to keep up with the change, for you to become a leader in your market space, or even just in the small community that you have built, being able to having open dialogue consistently and be able to reflect on those critical points are the main driver to help you to truly move forward. Our second major strategy in leadership for you is cultivating a culture of trust and teamwork. Trust is the bedrock of any successful team, and especially in the way that we have to drive improvement in this industry. Healthcare, unfortunately, just like anywhere else, cannot be done by one individual people. And the stake of how we work together is so high because people's lives are dependent on it. Therefore, trust isn't just nice to have, it's a must to have. As a leader, you are responsible for creating an environment where trust become a default and not a question, and trust flourishes. It's more than just a team exercise of escape room or doing a project or learning a new thing together. It's about consistently demonstrating transparency, integrity, and respect in your daily interaction. Considering the cautionary tale of Cyrano, the lack of trust and open communication led to one of the biggest scandals in the health tech industry. As a leader, you must ask yourself, are you fostering an environment where a team member feels safe to even speak up? And when they do speak up, what does that mean? Even if it is to challenge your idea of what you see the vision of your team, your company, and the new project that you guys are working on. On the flip side, look at companies like Teladoc Health. Dr. Jason Runbeck, their CEO, attributes their success to creating a culture of transparency and trust. This approach is not just a boosting morale, but also lead to groundbreaking innovation in telehealth, resulting in a 98% year-over-year revenue growth in 2020. In your healthcare startup and organization, are you encouraging team members to have open dialogue? How often do you have set up specific ways where people can contribute and give feedback to each other? And how do you set different expectations so people don't feel like when they give feedback is questioning their ability, but simply coming together to improve on how you can perform better? Are you actively listening to your team's concerns and ideas? And understand active listening is a skill set to have, which means your ability to listen without constantly wanting to respond to the concerns or questions, but able to summarize their word into the way that you understand and feedback on did you even understand that correctly? And remember, effective healthcare communication isn't just about disseminating information. It's about creating a two-way street where everyone feels heard, understood, valued, appreciated. This approach not only can enhance your team's cohesiveness, but also serve as a powerful risk management tool that allowing potential issues to be identified and addressed before it festers into something much bigger and much costly. So, action item for this section is, how are you empowering and addressing your team's concerns earlier on? And how are you empowering your team members in their daily function and allowing them to come up with novelties, ideas, to step outside their everyday, this is what I have to do, this is in my job description, to more proactively thinking ahead. And these practices are crucial for fostering a culture of trust and collaboration in your healthcare venture. And as you know, in Post-Point Path, we prioritize ourselves in the human capital, social capital, and culture capital. Because as you're raising funds for the next round, or as you're trying to scale your business, it's no longer just the strategy need to be in place. So you have a guidance system, a plan, but the right people with the right skill set, with the right personality, with the right communication skill, and with the right influence can truly make and break your company. Our third section is developing and inspiring your team. Continuously development of your team is not just beneficial, it's essential for survival in the health tech industry. What does that mean? As leaders, your role extends far beyond managing the day-to-day activities and operations of your company, or even just figuring out what you have to do, what your mindset needed to be. You're responsible for nurturing and growth and development of your team. And as many survey and study have seen, especially in the younger generation of the millennials and Gen Zers, people will stay with the company only if they are in agreement of the same vision and direction, and they feel appreciated and valued that they're doing something amazing or great. Therefore, if anyone doing the same task over and over again, they will start losing the internal drive of motivation. Therefore, it's not just about sending them to conferences or providing online courses. It's about creating a culture of continuous learning and improvement, and creating active dialogue where you can actually have these discussions where people come together and share their perspective. Take a page from ZocDoc's playbook. When they faced stagnation, a common risk in this fast-pacing health tech space. CEO Oliver Kazraz didn't just focus on product development, which many founders tend to do that. Perhaps it's because our platform isn't as good, as user-friendly. Perhaps we needed to add in more services and products to diversify. It's actually about what do you need to do to truly create the activity, focus, and motion to double down on the right thing to do. So he implemented a robust professional development program, investing in his own people, growing his own human capital. The result, a surge in innovation within the company, launched several new products and expected a 35% increase in doctor participation on their platform. Amazing, isn't it? Are you providing similar opportunity for your team? Remember, in health tech, staying current isn't just about keeping up with the news, with the buzz. What are the new AI things? Who are using what tools? It's about keeping with the newer mindset of positivity, improvement, self-motivation, and continuous to adapt into what you need in your specific niche and in the culture that you have created for your company. Now, some people misunderstood how we use the term shaping the culture. You create the culture from how you initially bring the people into the company. And therefore, we never is able to train someone to be nice. They have to come in with that core value. And therefore, what are the fundamental things that you need to have? And reshaping a team and culture, it is tough. So sometimes you have to swallow the hard pill to say, perhaps at some stage, these people need to be shifted to new roles, new titles, or they need to actually not hold back the rest of your team, and they should be moving on with the next phase of their own career. Leading by example is another crucial aspect of the team development. Look at Anne Wojcicki, co-founder of 23andMe. She's known for her hands-on approach and willingness to tackle challenges aside from her team. This leadership style has fostered a culture of innovation and resilience, enabling 23andMe to navigate complex regulatory sector and emerge as a leader in consumer genetics testing. So for you, as an innovator, an executive, a leader, you need to ask yourself, are you rolling up your sleeves and getting involved in the nitty-gritties when needed? Are you showing your team that no task is beneath you? And this kind of leadership is not just inspiring, but also give you a grand view of the challenges your teams are facing and enhancing your ability and capability to reduce any type of growth risks. And at the end of the day, we have to think about increasing your bottom line, creating that best operational workflow is actually depend on the right people, doing the right tasks, having the right ability and the right support resources for everything to work synchronistically. So practical questions for this section is, how are you investing in your team's development? Are you leading by example and sharing both the success and the challenges? Now we're getting down to the practical steps for you as a leader. In the space of setting and maintaining high standards, as we all probably have, isn't just about quality control. It's about saving lives and improving patient outcome. And if you keep that end goal in mind, then you can establish clear and achievable goals to provide regular feedback to keep your team aligned and motivated. Consider Epic System, one of the largest EHR systems, under the leadership of Judy Faulkner. They have consistently set high bar in electronic medical record, a critical area in healthcare communication. Now, we also know some people love, some people hate why we have to charge so much. And in some degree, EHR is considered simply documentation and reviewing system orders, not so much about bringing all the right information and help us disseminate. But that's another conversation. But despite of what you believe or disbelieve in the effectiveness of any EHR system, it still is a critical part of our current practice within medicine. Their unwavering commitment to excellence has resulted in Epic holding over 50% of US patient record. As a leader, are you setting similar high standards? Are you providing your team with the tools and supports they need to meet these high standards? Simply setting standards without giving people the right resources and support are actually pretty pointless, because you're going to create an environment where you would thought things can be done much easier, or it should be done ABC way, but people actually don't have the grasp or the ability to carry things out. Where if you are so focused on the result, but losing the process you need to be building out, that also make you to have more anxiety in why a certain standard is not being held up to be able to deliver. And versus the people who have a really high standard in the processing, but if you too much into the detail of how to do things, that controlling tendency also decreases the ability for your team to be able to perform. So finding that happy equilibrium of both giving support, tools, resources, as well as allowing people to bring out their own talent, motivation, strategy, discoverability to create that system for you, for everyone to keep up a high standard. Now, therefore, accountability comes in such a critical point right now, because both accountability and credibility, by you say you're going to do something, you actually deliver, is a non-negotiable in healthcare leadership, in both keeping you accountable and your team. At this time of our industry, the way that we move almost feels like lightning, not really turtle speed. And when people wanted to take time to reflect, allow that to happen. However, how are you keeping them accountable with a certain time frame for specific delivery? And these qualities are essential for effectively reduce any risk from your investors, your own sweat, money, tear, and effort to build this project, build this company, and everybody else that has been joining you along the way. Building trust with your team and your stakeholders, and making sure that everyone actually not just trusts you, and trust really is based on what are you able to share, say, do, and deliver the result that you promised. And take a lesson from Atul Gawande's experience with Haven, the joint health care venture of Amazon, Berkshire Hathaway, and JP Morgan Chase. When the venture faced challenges and eventually closed, Gawande openly acknowledged the issue. This transparency, although difficult, earned him the respect in the industry and paved the way for his current role in the Biden administration. In your healthcare startup, how do you handle setback and failure? How are you fostering a culture of mistakes are seen as learning opportunities, not as a failure or a punishment? How are you setting At the same time, high standards where people feel they can achieve these standards, these results, these big audacious goals that all of you have. Remember, in this current healthcare environment, failure is inevitable. It's how you respond to these failures that defines your leadership and shapes your company's future. This section's reflection point. How do you handle mistakes in your organization? And how are you fostering a culture of accountability and continuous improvement with the standards that you have set? Building a trustworthy team in healthcare innovation demands more than technical expertise. It requires a commitment to self-reflection, trust building, and continuous development and leading by example. By implementing these leadership practices, you can foster a team that's not just high performing, but also deeply committed to the shared vision of transforming and improving our healthcare industry with the solution that you truly believe in. At Postpoint Pass, we understand the unique challenges faced by healthcare innovation. Our approach goes beyond traditional consulting, offering a comprehensive framework that addresses this crucial balance of human, social, and culture capitals, alongside of the right business model and traction. We help companies to build not just a product, but sustainability, growth-oriented companies. That means it's not just we have good revenue right now, but we don't know where we're headed. Is this the worst of the things we need to do, or do we need to cut certain things? At the end of the day, the best way to grow sustainability and able to create something that has rapid firing, that's able to create those 2-time, 3-time, 10-time growth rate, as you see some other company, it all comes down to both the people behind what you do and the right strategy that makes sense for your specific company and niche. Now, if your action don't inspire, your words won't. As this quote led us to serve as a powerful reminder that in healthcare, leadership is not just about setting an example through action. Leadership is about setting an example with action, not just words. It's about creating a culture of trust, accountability, and continuous improving that can't weather the storm of the challenges that we face every day. Yeah, everything that we do can be very rewarding. You also have to trust your vision. Let's quickly summarize today's episode where we dive deep into the critical practices of building an exceptional team. The 4 points are: number 1, mirror principle. Self-reflection is your first step to effectively leading and reducing risks in your venture. Number 2, building a culture of trust is non-negotiable for innovation and success in your sector. And number 3, continuous to optimize and develop your team and lead by example are crucial for navigating the complexity of healthcare industry. And number 4, setting high standards and maintaining accountability and are essential for long-term success and credibility. Now, I would love to ask you this. What leadership challenges in your health tech journey has taught you the most valuable lesson? Share your thoughts and experience on LinkedIn or wherever you're watching this. Tag me, Sabrina Runbeck. Let's continue the vital conversation for future improvement of our healthcare industry. Remember, in this field, we are stronger together. By sharing your experience and insight, we can collectively elevate the standard of leadership in healthcare innovation and ultimately leading the better patient outcome in a more efficient healthcare system.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.